Hello coders, welcome to Fast Coder 21 free medical coding YouTube channel. Today's session is medical record documentation flowchart. Every inpatient IP-DRG coder must know. Guys, as all of us know, inpatient coding is the most complex coding specialty among all coding specialties. As an inpatient coder, you need to check various documentation in order to code properly of patient visit. So in this session, we are going to learn what are the important documentations needs to have in order to code inpatient record properly. If you are visiting for the first time, please click on subscribe button to receive future updates. If you like this session, please click on like button in order to motivate us. This session is useful for the people who are currently working as a inpatient coders as well as the people or coders who are trying to enter inpatient medical coding. So in order to know what are the documentation required for a inpatient coder, before that we need to know few definitions. So what is inpatient versus outpatient services? So inpatient services are provided when the patient is admitted to the facility for care with the expectation of at least an overnight stay. So basically in order to consider inpatient stay, minimum one overnight stay is required. Here patient will admit and he will stay for 1 day, minimum 1 day. So whereas outpatient services are for patients who are not expected to stay overnight in the hospital. So when do we need inpatient admission? So when there are complex surgeries as well as some routine ones, we need inpatient admission. So if the patient has serious illness or medical issues that require substantial monitoring, we need inpatient admission in order to give childbirth even in cases that don't require cesarean section. So based on the complexity of the patient's condition. So rehabilitation services for psychiatric illness, substance misuse or severe injuries also warrants inpatient admission. So in order to know documentation flowchart in inpatient, we have divided it into 3 stages. So now we are going to learn each stage individually. In first stage, patient will be admitted to the hospital and he will undergo initial assessment. So in the second stage, patient conditions evaluated and treated by the physician. And in the third stage, patient will be discharged. So here we will learn what happens in first stage. So in first stage, as we have discussed previously, patient will be admitted to the hospital and he or she will undergo initial assessment. So what happens in first stage? Physician admission orders written, history and physical documented within 24 hours, and all documents including ambulance record, transfer forms, emergency department record incorporated into inpatient records. So as all of us know, inpatient record consists of various records including ambulance record, transfer forms, ED records. So after admitting diagnosis will be documented and also hospital face sheet with patient demographics like name, address, insurance will be generated in first stage. So here second stage consists of patient conditions will be evaluated and treated by the physician. So how does the physician treat the patient? So using the diagnostic test, physician will treat the patient using diagnostic tests like X-ray, lab, ECG, pathology reports and other specialty tests based on the patient's condition and its severity. And also if the situation required, physician will provide the orders including but are not limited to diagnostic tests, therapies and services are ordered according to the indication or diagnosis. So based on the diagnosis or indication, physician may order other elaborative tests. And after that, patient's progress documented in progress notes. So in inpatient setting, progress notes plays a very important role. So in order to code properly, you need to have a look on progress notes also along with discharge summary and HMPs and consultations. So when there is a requirement, consultant will visit the patient and order other tests. Basically, consultant's visit will be need to be ordered by attending physician, and procedures operative or progress notes will be documented in second stage. So by the end of second stage, patient will be recovered from his condition and he will be ready to be discharged. So in third stage, patient will be discharged. So here documentation and discharge summary or discharge progress note of patient's hospitalization and discharge diagnosis include discharge diagnosis, hospital course. So discharge diagnosis, what are the diagnoses identified by the physician, and hospital course, a summary of the patient's hospitalization. So which includes the criteria which followed by the physician in order to treat the patient, and it also contains discharge instructions. So physician will provide discharge instructions to patient in order to follow up with the physician, and also here we will find discharge disposition. So if a patient is transferred, we will need to have a separate transfer summary. If the patient is transferred, we need to have transfer record. If patient is acquired, we need to have death certificate. So as an inpatient coder, if you know all these stages properly, one after another, you are able to code the inpatient record very easily. Thank you guys. Thanks for watching Fast Coder 21. Please comment, like, subscribe and learn.